Finasteride and minoxidil are two of the most talked about treatments for hair loss. But how do they actually work, and what should you really expect? Let's break it all down so that you can make the best decision for your hair.
Hey guys, Dr. Gary here. I know you've been waiting for this video. This is on finasteride. The outline of this talk is the history, the mechanism of action of finasteride, the efficacy, the topical use of finasteride, the decision between dutasteride and finasteride, the side effects, which I know are very important to talk about here. Post-finasteride syndrome, we're gonna tackle it. I know it comes up a lot, people are very worried. Finasteride for women, finasteride and hair transplant. So keep in mind that this is part of our series on non-surgical hair restoration. We have also many surgical videos on hair transplants, but this is for the non-surgical side of things. And just a reminder that with medical therapies, whether it be like a pill or a topical, or something like PRP, a procedural type of treatment. These are all things that you need to be continued in order to continue to see beneficial effects. It's not one and done like with surgery, so that's just something important to keep in mind. And I generally recommend at least 2 modalities of medical therapy when you're considering hair maintenance and regrowth. Let's go through some brief history of finasteride. Finasteride was first used to actually reduce benign prostatic hyperplasia, or BPH, by reducing the volume of the prostate. So this is a situation where usually, of course men, have larger prostates and they have difficulty urinating. So if you're able to shrink down the prostate with the use of this drug, then they feel better. And it was approved in 1992 in the US for the use of BPH. Then in 1997, it was also approved for the treatment of androgenic alopecia. So now let's talk about the mechanism of action of finasteride. Testosterone is first synthesized in the Leydig cells of the testes, and it enters the prostate gland, where it's subsequently converted to DHT, or dihydrotestosterone. And this reaction of testosterone being converted over to DHT is catalyzed by a membrane-bound enzyme called 5-alpha reductase. And DHT binds then to the androgen receptor. And this is what causes the miniaturization of the hair follicles. Finasteride is a competitive and specific inhibitor of 5-alpha reductase, and it's specific for the type 2 form of 5-alpha reductase. There's 3 types of 5-alpha reductases in our bodies, type 1, 2, and 3. So finasteride targets type 2 5-alpha reductase, and in so doing, it's blocking that conversion of testosterone to dihydrotestosterone. Okay, so that's the mechanism of action. And for androgenic alopecia, it's typically taken orally at a dose of 1 milligram per day. And by taking it in that way, it has been shown to rapidly lower serum and scalp DHT levels by over 60%. And as you take finasteride, it will stabilize hair loss and promotes hair regrowth. So some would argue that Propecia, which is the brand name of finasteride, is actually more effective than generic finasteride, because the generics are made in different places around the world that sometimes have quite varied manufacturing protocols, and even though there's the same active ingredient, the efficacy of the actual medication has been shown to sometimes be quite different. So now, how effective is finasteride, especially compared to minoxidil? And we're going to display this graph that I found in a really nice review article from 2017. And it's been shown to essentially be, this is many different studies compiled into this graph, and it's been shown to be almost twice as effective in increasing hair density and thickness. And this is based on many different studies. So again, finasteride is going to be more effective for you in general. Again, every individual might be a little different, but on the whole, finasteride more effective than minoxidil. And that's again why it's such a commonly prescribed medication, especially for someone who's looking to stabilize their hair loss. So that's why we recommend it for a lot of people, right? It's not because it's one of those things out there, it's actually one of the most effective things out there. Now let's talk about the topical formulation of finasteride. This is off-label use right now, has not been FDA approved for hair loss. It has been shown to be safer in patients who especially are looking to avoid those systemic side effects of finasteride. Currently, the topical formulations of finasteride that have been tested are gels and solutions at varying concentrations. And all of them, which have been tested in and obviously reported on, have resulted in improved hair growth, which is great. But remember, people aren't going to be publishing the negative studies, right? There's a publication bias there. Just something to keep in mind. So far, so good. The early studies do show some promising results. And topical finasteride does appear to be at least non-inferior to the systemic oral finasteride for hair regrowth, which is very promising. And it can be applied alone or in combination with minoxidil. You can also combine finasteride with minoxidil and or dutasteride, and that's been shown to be more effective at hair regrowth than topical minoxidil alone. So there's a study that shows that. And in terms of the doses, you're looking at 100 microliters to 200 microliters of topical finasteride, which is concentration typically of about 0.25% solution, and that's applied daily. And again, it appears to be fairly effective from what we see so far. We don't yet know the most effective concentrations and frequencies and all that, but the most frequently done application protocol is that 0.25% concentration and 100 microliters to 200 microliters. But we need more studies. We need more studies to determine the efficacy of long-term hair regrowth from topical finasteride, how safe it is, cost effectiveness, patient tolerability, and satisfaction. That's still pending, the final verdict on it, but the early studies do look promising, which is great. Now, what is dutasteride? You may have heard of that. So of the three isoforms that I mentioned at the beginning of the talk of the 5-alpha reductase, dutasteride inhibits not just type 2 like finasteride, but also type 1. So it inhibits both type 1 and type 2 5-alpha reductase. Dutasteride has been shown to be 3 times more potent than finasteride at inhibiting type 2 5-alpha reductase and 100 times more potent at inhibiting type 1, because finasteride doesn't really inhibit type 1. It's dosed at 0.5 milligrams per day, and at that dose, it can reduce DHT serum levels by upwards of 90%, and compare that to the 70% from finasteride. And the efficacy for hair regrowth is even higher at the higher doses of dutasteride. So if you go from 0.5 milligrams to 2.5 milligrams per day, the studies show an even greater improvement for hair regrowth. So why aren't we all doing that? Because the side effects are also worse. So there have been studies that have pointed to a higher incidence of side effects from dutasteride, especially as you go to those higher doses. So it's more effective, but higher risk of side effects. While the use of dutasteride for androgenic alopecia is off-label in the United States, it's actually approved in South Korea, and it has been since 2009 at the 0.5 milligrams per day dose. So they have, I guess, enough data as far as their agency is concerned, their equivalent of the FDA, to have approved that medication at that dose. But again, the side effect profile in general at any dose is worse than for finasteride. And we're gonna put up a graph here to show you guys sort of the side effect and efficacy dilemma, I would say, of finasteride and dutasteride. So as you go from finasteride to dutasteride, up into the higher doses of dutasteride, the efficacy goes up, but so do the risks of side effects. The question also that I get a lot is, how long do I need to be on finasteride? For as long as you want to maintain your hair in that DHT sensitive zone. So that's going to be that frontal, mid-scalp, and crown area. So for as long as you want to maintain that hair, you need to be on the pill, and that goes for all forms of medical therapy. Now, let's get into the side effects of finasteride. Most commonly reported side effects, as many of you have heard of, are sexual side effects. That includes erectile dysfunction, ejaculatory dysfunction, and the loss of libido. And all the studies on a whole for finasteride, you're looking at about a 2% risk of those sexual side effects. It has been shown, finasteride, to actually lower the risk of prostate cancer, and that, remember, is partly due to the effects on BPH, as we talked about in the beginning of the talk, but it can increase the risk of high-grade prostate cancer. So lowers the risk in total of kind of all prostate cancers, except for the high grade. It can actually potentiate that type of cancer. So that's, again, one of those things to keep in the back of your mind. Depression has been associated with the use of finasteride, and the theory there is that by decreasing dopamine levels, you actually are leading to some forms of depression. And we have a table here that we'll show from one of the papers. And the side effect profile is actually very similar from finasteride 1 milligram to finasteride 5 milligrams. So some patients, I know, they're worried about even 1 milligram, they'll cut it down to 0.5 milligrams. Based on a literature review that I've done and that I've seen, there's really no major benefit. Most of the studies that are done on and for androgenic alopecia are with the 1 milligram dosage. So I would just kind of stick to that if you're going to take finasteride. And the side effect profile for finasteride is worse in men who are starting at lower baseline testosterone levels. So some people recommend actually checking your testosterone levels before starting this pill and using that as a parameter to decide on whether or not you should take it or not. So that's one other way to go. So let's get into what is post-finasteride syndrome. This is something that's in a lot of the forums online, and people are just worried about it. Post-finasteride syndrome is the occurrence of persistent adverse events, including sexual dysfunction and depression, in a subset of men who have used 5-alpha reductase inhibitors such as finasteride. And it is important to point out that in 2012, the FDA in the US required that for finasteride labels, they include multiple persistent side effects. In the past, before that, that wasn't a thing. No one recognized it. Now, people started to, at least over the last 10 years. It is difficult to size up this syndrome, partly because of the multifactorial background of the adverse events, partly because of the subjective criteria of diagnosis, and also because of the variable reporting. A lot of the studies, they didn't really necessarily ask those questions. They didn't have the mechanisms in place to figure out if that was really something that was happening to people later on after they stopped finasteride or not. But also equally important to point out that sexual dysfunction and depression are sort of common things that also coexist in patients who have never been exposed to finasteride, and it's not always something that's elicited at the beginning of the study. So if you're finding out later on, say you do a study, a year later, you poll everyone, some people have stopped finasteride and they've developed this post-finasteride syndrome, but the study never asked them beforehand, right at the start of the study, do they have any sexual issues? Do they have any depression or anything that might be later related to the depression that they developed, So that's part of the problem with figuring out, how real the syndrome is or how high the incidence of it is. I think we know by now that it's real, but we don't know how prevalent it truly is. And the other important point to bring up is this nocebo effect. It's the opposite of a placebo effect. It's the notion that if you're told that you might have a negative experience with something, that your risk of having that negative experience goes up. So if all you read in the forums is about this post-finasteride syndrome and how bad it could be and all these things that could go wrong, when you actually get started on finasteride, you might have a higher risk of developing these issues compared to someone who's never really heard of it, or where those risks were kind of minimized to them early on, which is interesting. I'm not saying we should minimize the risk or not inform people fully before offering them the medication, but it is an interesting phenomenon. So there was a study that when patients were treated with finasteride and informed about a possible sexual dysfunction caused by the therapy, nocebo effect was significant. The fact of the information being given to them at the beginning of the treatment caused a 14.3% increase in the reported sexual side effects. So it's a real effect, and it's something to keep in mind. The other thing to point out, there was a study from 2017 that looked at side effects of finasteride, and we're gonna scroll through the charts that they have at the end of the study and highlight the column that is showing you the persistent side effects. And if you look and you see, there are very few out of all the studies that this one paper looked at, which was many, 20, 30 studies, there were very few that report on persistent side effects or that had any persistent side effects from the use of finasteride. So it is uncommon. It is not something that will likely happen to you, but there is some remote chance of it happening. That's, I guess, the best way to frame it. And there's even this Post-finasteride Syndrome Foundation in Summit, New Jersey, that is like a whole support group, and they do a lot of other nonprofit activities related to this type of scenario. So if you want to learn more, you can go on their website. So is finasteride safe? Overall, yes. Many people are on it. Many people have been on it for decades. Can it cause sexual side effects? Yes. If the side effects develop, stopping the medication will almost always reverse the side effects. That's what I gather from the review of the literature. Of course, if you're one of the unfortunate ones to have developed post-finasteride syndrome, you're going to have a much stronger opinion on what I just said. So given the remote possibility of post-finasteride syndrome, the individual who is considering starting this pill really needs to properly balance the pros and cons before going on the pill. And they need to do this in consultation with a trusted doctor. Now, in terms of finasteride for women, the evidence is overall positive for the efficacy of finasteride in women, though there are some randomized studies that actually show no improvement in women. And in women who may or may not be pregnant, the main risk is birth defects in the male fetus. And therefore, it should generally be avoided in this group. So women who are pregnant or who may become pregnant. It's usually reserved for postmenopausal women primarily. That's the only kind of group of people that I would consider giving finasteride to. And the side effects are somewhat similar with some added ones as well. Decreased libido is the primary side effect in women, along with occasional risk of headache and GI discomfort. And finasteride is definitely not the first choice in women for hair restoration, but it may be a helpful adjunct for some. So now let's just finish off here with the connection between finasteride and hair transplants. This is where it gets interesting because a lot of hair transplant surgeons like myself are very pro finasteride because we're thinking about the final kind of hair result for someone who's interested in a hair transplant, assuming they're a candidate for a transplant. Some people should just start with finasteride or some other medical therapies and are not transplant candidates. But for those who are, especially for those who are under 45, we really rely heavily on maximizing medical therapy to prevent the loss of native hairs. Because if you have continued loss of your native hairs, it's again that analogy of having a bucket of sand. You're pouring sand in, but there's a big hole at the bottom. Eventually you're going to run out of sand, right? So that's exactly the look of your hair on your head. So we want to preserve what you have with the use of something like finasteride and then augment, add on top of it, or add into places where there's no existing hair with a hair transplant. So finasteride is really a major part of medical management in every practice. And for a younger patient who's interested in a hair transplant but who's not interested in finasteride, it could complicate matters. And we just have to be extra cautious because we don't want to do a large procedure and then they lose all their existing hairs because they don't want to do anything to stabilize it. And then it's a poor result at the end of the day. The following talk is about minoxidil, which is one type of medication that's used for non-surgical hair restoration. In this talk, I'll be covering the history of minoxidil, which is also called Rogaine. Rogaine is the brand name. I'll be going through the mechanism of action of minoxidil, the different formulations of the medication, as well as its side effects. So let's start with the history of minoxidil. Minoxidil was introduced in the early 1970s as a treatment for hypertension or high blood pressure. It's really rarely used today for that same purpose, but that's how people found out about its benefits for hair restoration. One of the side effects of the medication was hypertrichosis, which means increased amount of hair on different parts of the body. And people found that when you had different patients on oral minoxidil, they were getting these situations where more hair was growing in other parts of their body, including hair on the head and the beard area. So this led to the development of a topical formulation of minoxidil for the treatment of androgenic alopecia in men and then subsequently in women. And as you know, androgenic alopecia is the most common form of hair loss in men and women. So the 2% product was first marketed for hair regrowth in men in 1986 in the United States, and then the 5% product became available in 1993. So moving on to the mechanism of action of minoxidil. So minoxidil is actually what's called a prodrug, which is not the active form of the medication. It's then converted to its active form, which is called minoxidil sulfate. And that's done by an enzyme called sulfotransferase. That enzyme is expressed in the outer root sheath of hair follicles. The higher the enzyme activity in a person, the better the response to minoxidil. And that's why not everyone responds as well as they'd like to minoxidil. Minoxidil is a vasodilator that works by opening up potassium channels on smooth muscle as well. And that's how it works to lower blood pressure when it's given in a high enough dose in an oral formulation. It also has been shown to enhance hair growth, and it reduces hair loss. Specifically, it prolongs the anagen phase of the growth cycle, which is the growth cycle responsible for improved growth of the actual hair. And there are actually some new tests that are assessing sulfotransferase enzyme activity in kind of plucked hair follicles to predict treatment response. So generally, low enzyme activity will mean that you have a limited response to minoxidil, and then the opposite is also true. High enzyme activity means a better response to minoxidil. And one interesting point is that salicylic acid, which is an aspirin precursor, actually inhibits that same enzyme expression in the liver, and that's why it really should be avoided if possible for optimal efficacy of minoxidil. So let's go through the different formulations. We're going to start with the topical formulation. So it's one of only 2 US FDA approved drugs for the treatment of androgenic alopecia. It's also used off-label in other hair loss disorders, including alopecia areata, which is what I have, but usually not in universalis, which is the subset that I specifically have. But it's also used in beard and eyebrow enhancement, for example, as has been shown to work for those applications as well. It comes as either a solution or a foam product. The solution, which is the original sort of formulation for the topical minoxidil, has what's called propylene glycol in it, which improves the delivery of the drug into the hair follicle, but it also causes local irritation. So the foam is easier to use because it's quicker to dry and it's more localized in its application. So it's kind of the more popular choice between those two. For men with androgenic alopecia, it's recommended that you do a twice daily application of either 1 ml of 5% minoxidil solution or half of a capful of 5% minoxidil foam. For women with female pattern hair loss, it's recommended twice daily application of 1 ml of 2% minoxidil solution or once daily application of half a capful of the 5% minoxidil foam. And the reason for that is that you want to reduce the side effects of the medication. We'll go through the side effects later in the talk, but women are more susceptible to getting that additional hair growth in other parts, specifically of the face. So to reduce that side effect, you want to keep that foam application, especially at 5%, down to once a day. And what's interesting is that with the topical formulation, approximately 1.4% of the actual topical minoxidil is absorbed through the normal scalp. So most of the actual drug is not being absorbed through the scalp, and that is why other formulations exist and are still prescribed for hair restoration when it comes to minoxidil. And following 4 months of twice daily application, less than 40% of patients regrow hair. And that's something that is important to remember, and one of the reasons why it's not used as widely as it potentially could be, and that's because not everyone's a responder, and we talked about earlier why that might be, and that's because of that sulfotransferase activity and enzyme expression. Why do people stop using topical minoxidil? The main reasons are poor regrowth of hair, the fact that it's a twice daily application, undesirable hair texture, which can occur in some people, scalp irritation, especially with the solution, and a shedding period, which usually lasts for about 3 to 6 weeks. And because of these shortcomings, some opt for an oral formulation of minoxidil. So let's talk about that. So remember, the oral formulation of minoxidil is actually how we discovered its beneficial effects for hair restoration. It was used for blood pressure control, but for blood pressure control, the doses are much higher and are different from the doses used for hair loss type of conditions. The adverse effects that are seen with oral minoxidil are much higher and much more serious the higher the dose that's given. So the blood pressure doses for hypertension are on the order of 10 to 40 milligrams per dose, whereas for hair restoration it's generally 5 milligrams or under. And so low dose oral minoxidil has been shown to be safe and effective for hair growth. The doses are as low as, this is again per the literature, the doses are as low as 0.25 milligrams daily for women with female pattern hair loss, and that's been shown to be effective, and as low as 1 milligram for men. Though in men, based on various studies, the recommended dose is actually 2.5 milligrams to 5 milligrams for the oral daily dose. There's also, and this is what I was telling you guys in the beginning of the talk, there's also sublingual application of minoxidil, and that involves taking a pill, putting it under the tongue, and allowing it to dissolve. And there was a study in 2020 from Dr. Sinclair in Australia that was a retrospective review of 64 patients, men and women, and they had a 6-month follow-up period. The advantage of the sublingual administration is that it actually bypasses hepatic, which means liver metabolism, and therefore it increases the bioavailability of the drug, meaning there's more of it actually working in your body compared with the oral administration of the pill. And the doses used in his study were 0.45 milligrams daily. 20 of the 64 patients were actually increased to 0.9 milligrams daily. And in his study, he found that there were improvements based on a global assessment of the photographs, as well as hair shedding scales that were shown to also improve in the study. The side effects that he showed were mild hypertrichosis in 8 women. There was mild postural dizziness that occurred in 3 men and 2 women, and there was mild edema that occurred in 2 women. So overall, good safety profile to the sublingual formulation. And this definitely is very promising, but we need prospective studies, we need additional studies, and there was also a lack of statistics that I saw in that retrospective study. So basically we need to study it much more before that could be recommended, but it's definitely a very interesting and novel approach, and it could end up being a very kind of beneficial way to administer minoxidil. So let's now go over the side effects of minoxidil, both with the topical applications as well as systemic use. As far as the topical side effects of minoxidil use, you have the contact dermatitis, and that is mostly from the solution formulation. You have headaches, which can occur, hypertrichosis, which we already covered, and that's been shown to be worse in women. 5% formulation of the topical solution is actually more likely to give you these side effects compared to the 2%. Which makes intuitive sense. As far as systemic side effects of minoxidil, which you can get from oral use or sublingual use, there are some serious side effects at the high doses, again, at doses that are given more for the blood pressure type of application rather than for hair restoration. And those systemic side effects include different types of fluid retention problems that can result in something called pericardial effusion, as well as a few other conditions, swelling of the legs, things of that nature. And as far as the termination of treatment, because a lot of people think that when you stop minoxidil, you just start to lose your hair right away. And many of my patients are worried that if they miss 1 dose, that all of a sudden everything will just, be lost, all the gains that they've made. And that's really not true. There's a progressive decline of hair that occurs over the course of about 12 to 24 weeks is what's been shown in the studies. It's not a kind of instant on-off switch. So it's okay to miss the occasional dose of minoxidil. You're not going to lose your hair right away. from that. So let's summarize what we've talked about and what we've learned so far about minoxidil. I'll also give you an idea here of what I generally recommend when it comes to, like, clinical practice and how you should administer minoxidil, both for yourself and sometimes maybe going to your doctor for a prescription. So keep in mind that for the topical formulation, at least in the United States, you don't need a prescription, right? You can go to the drugstore and you find it on the shelf. So you start with topical minoxidil. Generally, the foam version is recommended. You can start with the 2%, but I would just recommend starting with the 5% if you're able to tolerate it. And I would recommend attempting it for at least 3 months to see what kind of benefit you might get from it as far as your hair growth. This includes not just the scalp, but it can include eyebrows and could include the beard as well. So if you're tolerating that and you're seeing some improvement, great, continue using that. If you're unable to tolerate the medication, the topical, like for example, if you get a headache that becomes persistent, or you get this hypertrichosis effect where you get extra hair on the face that you don't want, in the case of women, for example, or you don't see much of an impact with the topical formulation, you could then bump up to oral minoxidil. You need a prescription from your doctor for this, and you want to start with, again, low dosing, right? 5 milligrams or less, and it's really gender specific based on the studies. Women do well with lower doses of minoxidil oral, and then men do better with the doses of the 2.5 to 5 milligrams daily dose. So again, you have to talk to your doctor, see if it's okay with all the other medications that you take. I can tell you that in my practice, for women, I might start with a 1 milligram per day dose. For men, closer to a 2.5 milligram per day dose, and most people do extremely well and tolerate the pill well, and definitely, many people see some benefits with oral minoxidil.
Let me tell you why I don't recommend topical minoxidil, or Rogaine as it's more commonly known, to my patients, even though it's one of the only FDA-approved treatments available for hair loss. Let's go over a common clinical scenario. A 26-year-old man or woman comes into the office complaining of some hair loss. Maybe their hair is thinning or their hairline is receding, and they're diagnosed with androgenic alopecia, the most common form of hair loss. Topical minoxidil is then recommended to prevent their hair loss. But then 6 months or a year goes by and they're continuing to lose more hair. And they aren't sure what to do next because they're taking a medication for their hair loss. Let's go back in time to August of 1988, when the FDA approved topical minoxidil for treating men with baldness under the name Rogaine. It's interesting to note that the FDA actually rejected the initial submission under the name Regain because they thought it was misleading to the consumer. And in the original clinical trials, what was found is that patients who used topical minoxidil twice daily for 4 months had the following outcomes. Dense hair growth occurred in about 8% of patients and moderate growth in 31%. The remaining 61% of patients experienced little or no change. Now let me give you the reasons why I actually kind of hate topical minoxidil. It's not getting at the underlying mechanism of hair loss in most men and women, which relates to androgens. There was a study done in hamsters in 1987, and it was concluded that topical minoxidil does not act as an anti-androgen in the flank of the golden Syrian hamster, and that was later confirmed in human studies as well. Instead, it can help with converting some of our villus hairs, or the finer hairs, into more terminal hairs that are more robust, essentially improving the caliber and the length of hair, not really increasing the number of hairs, and also not preventing further hair loss. So the main problem is that people are starting this medication to prevent further hair loss, but they're noticing that more hair is falling out because there's nothing truly preventative about topical minoxidil. It's like hitting the mark but missing the bullseye. Instead, most people ought to be on an anti-androgenic agent to help with hair loss prevention, and that includes agents like finasteride or spironolactone, because more importantly than thickening up some of the hairs that you have, it's essential to try to reduce further hair loss. Keep in mind that minoxidil is a stimulant for your hair, and topical minoxidil is a weak form of stimulation. Other ways to stimulate the growth of of your hair include PRP, or platelet-rich plasma, low-level laser light therapy, microneedling, and exosomes, and we've talked about each of these different methods on this channel previously. One way to think of minoxidil as a stimulant is to think about this type of analogy. Let's say you're feeling tired, right? What do most people do? They get a cup of coffee, right? And that acts as a stimulant to make us more awake and able to function better. But it's not necessarily getting to the underlying reason for your feeling tired. It's most likely because of a lack of sleep. So the right way to approach the problem is usually to get more sleep rather than just drink coffee. But in many cases, people do both. Anti-androgenic medications like finasteride or other DHT blocking agents are essentially the equivalent of sleep for your hair. They get to the root cause of hair loss for most people, no pun intended. Let's briefly go over how anti-androgens work. Normally, DHT goes on to affect DHT-sensitive hair follicles, leading to miniaturization, and that eventually leads to hair loss. DHT blockers block the conversion of testosterone to dihydrotestosterone, which is the more potent form of that hormone, limiting the effect on hair loss. Oral finasteride at a standard dose of 1 milligram a day is effective in about 90 to 95% of men. Some do need higher doses or the more potent cousin Dutasteride to further prevent hair loss. And oral spironolactone is effective at the standard dose in about 50 to 70% of women. Other DHT blocking compounds that are more naturally occurring can be found in different products such as our shampoos, conditioners, or other styling products. These natural compounds can include saw palmetto, pumpkin seed oil, curcumin, and caffeine. I've made a video about this in the past, so if you're interested in these, make sure to check out that video. And we've designed our own hair thickening products with these key ingredients in mind, so to learn more, head to feelconfident.com. Another issue with topical minoxidil is its limited efficacy, especially compared to its oral form. In my practice, I see much better results with oral minoxidil compared to topical minoxidil for thickening up your hair. And we have a dedicated video on oral minoxidil on this channel. Let's go over a few recent studies on this topic. A recent study showed no statistically significant difference between topical and oral minoxidil, but this was likely because there were too few patients in this study, which was a total of 65 people. Another recent study on 52 female patients showed a slightly higher improvement in hair density with oral minoxidil, which was 12% versus 7% with topical minoxidil. But again, there was no statistically significant difference detected. Clinical research is hard, and it's hard to recruit tons of patients for these studies. So most of these studies have too few patients to really start to detect those statistically significant differences. So in my experience, instead of using 2% or 5% topical minoxidil, when you use 100% oral minoxidil, you tend to get better outcomes. If you're looking for prescription or non-prescription hair loss treatments, make sure to check out feelconfident.com. Topical minoxidil also can have some negative effects on your scalp. Specifically, it can cause a local irritation or an itchiness called pruritus on the scalp surface. This is usually because of an ingredient in the solution form of topical minoxidil called propylene glycol. While propylene glycol can improve the delivery of the drug, it also can cause this local irritation. And the foam version of topical minoxidil usually eliminates this issue because it's made without the propylene glycol. But topical minoxidil also leaves a greasy residue on your hair, and usually that requires you to wash your hair more frequently to try to get rid of some of that residue. Another reason why I'm not a major proponent of topical minoxidil is because of its twice daily application. So in addition to the residue that it can leave on your scalp, another reason why there's poor compliance with this medication is because it's supposed to be applied twice daily to the scalp in men, as opposed to oral minoxidil, which can just be used once a day. That encourages people to use minoxidil more regularly and more consistently to improve of their hair. Yet another reason why I dislike topical minoxidil is because of its potential for animal toxicity. Minoxidil is highly toxic to dogs and cats, even from very low doses, even if it's like from a drop or a lick. Signs of poisoning in cats include anorexia, vomiting, lethargy, difficulty breathing, fluid in the lungs or the chest, or low blood pressure. And for dogs, signs include lethargy, vomiting, bounding pulses, increased heart rate, and low blood pressure. Signs usually occur within 45 minutes to a few hours. And some of the toxic exposure scenarios can include a pet licking his owner's skin or pillowcase, a pet being splashed during a medication spill, a pet searching through trash. And there was a study that actually summarized these different types of scenarios. And one study found that death occurred in 8 out of 62 cats, that's about 13%, that developed clinical signs. And I think in general, the exposure is going to be reduced if a person takes a pill rather than putting this topical stuff on their head and leaving some residue on the pillowcase or really anywhere else in the house. So the takeaway here is that minoxidil, especially in its topical form, is a mild stimulant for your hair, but it's not getting to the root cause of the hair loss, which is hair follicle miniaturization from the effects of androgens. Eventually, you'll lose the battle with hair loss if you're only using minoxidil as your hair loss treatment, and you're not preventing it with anti-androgenic therapy. These are the top 11 questions that I get asked all the time about finasteride. Will minoxidil or Rogaine work the same as finasteride? Can I use a different medical therapy as an alternative to finasteride? Rogaine and finasteride are not interchangeable. They have different mechanisms of action. Finasteride does more to prevent the loss of your hair, whereas minoxidil is great at increasing the fullness of your hair. And that is why minoxidil and finasteride are complementary to one another and are often used as first-line medical therapy. And when you look at all the other medical therapies available, such as low-level laser light therapy, PRP, and microneedling, for example, none of them are an exact replacement for finasteride. All of them work to stimulate and to increase fullness of your hairs, rather than truly working on the basic mechanism of preserving hair by reducing levels of DHT. The only option for reducing those levels in an appreciable way is finasteride. There are, of course, some supplementations that may do something similar to finasteride, but none as potent as finasteride or its cousin Dutasteride. So in other words, none of these other medical therapies delay the further loss of your hair. And that's something that's really important to realize. What is the safest dose of finasteride? Well, the standard dose is 1 milligram per day. And that's the dose that we start all of our patients on. Some patients have concerns about potential side effects and they ask to be started on a lower dose. Now, lower doses are possible, but they're less effective. It does diminish the potential risk of side effects, but just realize that it's also a less effective option for hair preservation. I had good results on finasteride, but then my hair started to fall out. What do I do now? The first step that I recommend taking is to switch from a generic form of finasteride to the brand name Propecia. Sometimes Propecia is just made in a more reproducible, consistent way, and the way that it gets absorbed into the body is also more consistent, and that can lead to better results. So anytime someone's been on finasteride for a long time and it seems like it's no longer helping, then we switch over to Propecia first and see what impact that has over the course of, say, 6 months. If that doesn't help, or the patient doesn't want to spend more money on Propecia or just isn't interested in trying it, then we consider bumping up to Dutasteride at 0.5 milligrams per day. This medication is a more potent form of finasteride. Dutasteride is approved in South Korea by their version of the FDA, but keep in mind it's not approved by the FDA here in the United States for treating androgenic alopecia. So it is used off-label for that purpose. Also, keep in mind that with Dutasteride, it is a more effective method of preserving your hair. However, the side effect profile is worse. So your risk of developing side effects, including sexual side effects, is about twice as much with Dutasteride compared to Finasteride. And for many people, that increased risk just isn't worth it. Where can I get Finasteride? Finasteride is a prescription medication, so you need a doctor to prescribe it and to send it typically to your local pharmacy. We've been working on an online platform that allows you to get your prescriptions shipped to your door, and you can find out more at feelconfident.com. If I'm getting a hair transplant, do I have to be on Finasteride? It depends, but usually the answer is yes. When you have a significant amount of hair in the DHT sensitive zone, which for most people is like all of this, you want to preserve that hair, and you shouldn't rely on transplant surgery alone to restore all of it if you lose all of that hair. So when we're working with patients who have a lot of hair in this entire zone, and there's just say some hairline work that we're trying to do with the transplant, just as an example, the transplant will help bring fresh hair into that location, but it's not going to do anything to preserve the existing hair in the vicinity. For that hair, you need medical therapy, and the most potent, as we've spoken about, is going to be Finasteride at preserving that hair. So I always talk about having a stable foundation on which to then build. The medical therapy gives you that foundation, and then the surgery allows you to build. Also, keep in mind that Finasteride can help with preserving your donor supply. So it's not just the DHT sensitive zone where you have hair that's susceptible to loss. There are also portions of the potential donor area, the back and the sides of the head, where you can continue to see some loss over time. And if you're taking those grafts and you're transplanting those grafts over to, say, the frontal scalp or the mid scalp, those grafts are then susceptible to some degree of loss over time. So when you're taking Finasteride, you're also protecting the donor area as well. Oftentimes people forget this, and as we've moved from FUT surgery to more and more FUE surgery, it's more critical than ever to consider preserving that donor area, because when you do a transplant and you do an FUE procedure, you're harvesting broadly so that you don't over harvest a specific area and make it look more bald. And as you're harvesting broadly, some of that hair is outside of the traditional safe zone, and that's why you really want to keep that in mind when getting a hair transplant. Is Finasteride only helpful with the recipient area? No, as I mentioned previously, it can be great at, again, preserving the donor area and keeping it strong, especially in people who are susceptible to retrograde alopecia or to an expanding crown. Both of those phenomenon can actually shrink down the potential donor area from which you can get the grafts that you're going to be transplanting to the new location. What do I do if I develop side effects from Finasteride? Step number one is to stop the medication. I don't believe in continuing to use it despite having side effects. Step two is report it to your prescribing doctor. This is a prescription medication, so you have to have gotten it from someone. So talk to your doctor about what you're experiencing to see if the side effects can be linked to the Finasteride, because if they can, then it's better to stop the drug. Step three is once you've stopped the medication and you've given enough time for your symptoms to resolve, then you can consider restarting the Finasteride at a lower dose. And what that usually means, at least in my practice, is going down to 0.5 milligrams, which is about half a tablet every third day. So you reduce the dose and you reduce the frequency as well. And that usually leads to people being able to tolerate the medication, but also not having side effects. Now, in some patients, the symptoms persist even on low dose Finasteride. So if that happens, then I recommend trying out a topical formulation of Finasteride. For example, a 0.3% solution of topical Finasteride. It's not going to be as effective at hair preservation. It will also have fewer side effects. And for many people, no side effects. How dangerous is Finasteride for mental health? This is a controversial topic. Some studies and some people will purport increased depression risk due to the dysfunction of the dopaminergic system, and some suggest other mechanisms that are summarized in this chart. But there are inconsistent findings in the literature. But I think it is important to consider a history of depression in patients who are going to be started on finasteride. And I think people need to understand that their depression can potentially worsen with the use of finasteride, even if we don't fully understand the underlying mechanisms. Does finasteride increase your risk of prostate cancer? The answer is no, as far as we know in 2023. Now, there were some early concerns regarding an association between the use of finasteride and increased risk of high-grade prostate cancer, and that has not been borne out in more recent follow-up studies. And you can check out the New England Journal of Medicine article with updated information in the description below. How long do I need to be on finasteride? Now, keep in mind, this is a long-term commitment. It's not like you get on finasteride for a year, try it out, and just stop it because you didn't see any changes. Actually, if you don't see any progressive loss of your hair, that's a good thing. That means the medication is doing something. But oftentimes, people get on finasteride expecting their hair to look more full or to regrow the hair that they used to have, and that's not often what happens. Basically, whatever you're left with, you're trying to lock into place with the finasteride, not regrow hair that you've already lost. That can happen to a degree with finasteride, but often isn't the case. So it really is like a long-term commitment. Keep in mind, we lose the majority of our hair. The accelerated phase of androgenic alopecia is about mid-20s, late 20s into early 30s. So once you're out of that time frame, your hair loss is going to progress much slower. So there are some people who are on finasteride in their 20s, 30s, and then maybe even into their 40s. But by the time they reach 50s, 60s, they might start to see their more long-term pattern of hair, and they might have a very slow continued loss. And the amount of hair that they are losing might significantly slow down. So at that point, some people decide to come off of finasteride and see what happens after they've been on it for potentially decades. Can women take finasteride? The answer is sometimes. We want to avoid finasteride in patients who are premenopausal and who might get pregnant. We also want to avoid finasteride in pregnancy. Finasteride can lead to birth defects in a male fetus, but finasteride may be an option in postmenopausal women and for women who don't plan on having children. However, finasteride should be prescribed with caution for women who have a history of breast cancer. I'm on finasteride, but my wife and I are planning on having a baby. Should I stop taking it? Yes, finasteride, even at low doses, can potentially cause a reduction in sperm counts in some men. So I recommend stopping for at least a few months while trying to conceive, just to play it safe. I've been prescribing oral minoxidil to men and women in my practice for many years. Minoxidil was introduced in the early 1970s as a treatment for hypertension or high blood pressure. It's rarely used for those purposes today because we have better blood pressure controlling medications. Hypertrichosis or increased hair growth was a common side effect seen in patients taking oral minoxidil, including the appearance of more hair on the head. But because there were serious side effects from the use of high-dose oral minoxidil, there were attempts to create a topical formulation, and this is what was first tested for hair loss. The idea was to get benefits for one's hair without being subjected to the side effects of high-dose oral minoxidil. The 2% topical formulation was first marketed to men in 1986 in the United States. So who is oral minoxidil good for? Most commonly, it's used to treat patterned hair loss, such as male pattern hair loss and female pattern hair loss. It can also be used in chronic telogen effluvium, traction alopecia, alopecia areata, chemotherapy-induced hair loss, scarring alopecia, and eyebrow and beard regrowth. In terms of the basic mechanism of oral minoxidil, we covered that in our original video on this topic. But there are several roles that oral minoxidil plays in promoting hair regrowth. One is that it's a vasodilator, so that increases the oxygen levels for the hair follicles. Another is that it promotes the anagen phase of the hair cycle, and that is the growth phase of the hair cycle. It also reduces inflammation, and that's why it can sometimes be used for scarring alopecia. It stimulates the release of growth factors, and there have been some studies that have shown some potential anti-androgenic effects as well. Overall, oral minoxidil increases hair diameter and hair length. It basically takes hairs that are more in the villus form, which are finer miniaturized hairs, and transitions them closer to a terminal state, which is a more mature type of hair follicle. Some ask, how long will it be until I start to see the effects of this medication? The initial clinical response may take at least 3 months of treatment. Some people ask me, how long should I be on oral minoxidil? And the answer is, as long as you want it to continue to help you with your hair. It is something that you need to take for a prolonged period of time, and once you stop the medication, the effects that you gained from the medication slowly start to diminish. So you must keep taking oral minoxidil to maintain the effects of it. To get oral minoxidil, you need a prescription from a doctor, and most doctors are not comfortable prescribing this medication. Now you don't have to wait to get a consultation with me. We are offering oral minoxidil for men and women through a digital pharmacy and a prescription service. It's easy to get the medication shipped to your door within the United States. Go to feelconfident.com to sign up. We've been working on bringing you prescription hair loss medications at a very low price, so that people can afford it. So why is the oral form of minoxidil generally considered better than the topical formulation? For one, there is better regrowth of hair compared to the topical. It's just a much more potent formulation of the medication. The bioavailability in our bloodstream is higher after taking the pill compared to putting the topical solution or foam on the scalp. Oral minoxidil is used once a day compared to topical minoxidil, which is applied twice a day. With oral minoxidil, there is no scalp irritation. There is no unpleasant hair residue. There's also a lower risk of temporary shed because, as you know, with topical minoxidil, you can get several weeks of shedding that occurs right after starting the medication. And lastly, oral minoxidil is cheaper than its topical counterpart. In terms of dosing, for high blood pressure management, the original dose of oral minoxidil was given at 10 to 40 milligrams. The hair loss dosing is much lower, and that helps reduce side effects. In women, the recommended dose is 0.25 milligrams to 1.25 milligrams. In men, the recommended dose of oral minoxidil is 1 milligram to 5 milligrams. In general, the higher the dose, the better it works, though you also increase the potential for side effects as you increase the dose. And oral minoxidil can be taken with or without food. Keep in mind that minoxidil is only approved for androgenic alopecia as a topical formulation, not in its oral form. Oral minoxidil is, however, approved by the FDA for treating hypertension. So oral minoxidil used for hair loss is considered off-label use. As far as side effects go, they can be divided into mild and more serious forms. The serious side effects are extremely rare in the low-dose version of oral minoxidil. Mild side effects include hypertrichosis, usually on the face, which is again more hair growth, headache, dizziness, lightheadedness, leg swelling, and increased heart rate. For people who get lightheaded, it might be helpful to take the medication at bedtime. In terms of serious side effects, there's fluid retention that could occur and pericardial effusion, which is fluid building up around the heart. Side effects are dose dependent. So you lower the dose and the side effects diminish, you increase the dose and the side effects worsen. One study found that increasing the dose of oral minoxidil by 1 milligram increased the risk of having hypertrichosis by 17.6% and cardiovascular symptoms by 4.8%. In terms of hypertrichosis as a side effect, it most commonly occurs on the face. And the most affected areas on the face are the sideburns and the temples. Now, for some people, that side effect could be beneficial, but for other people, it can present a nuisance. Hypertrichosis could be managed by either lowering the dose of oral minoxidil or having the patient go through some hair removal procedures such as laser hair removal. Discontinuation of oral minoxidil due to side effects is quite rare. It was found to be about 1% in a multi-center study of over 1,400 patients. The following are contraindications to taking oral minoxidil, meaning that if you have any of these things, you shouldn't take the drug. 1. Pheochromocytoma. 2. Pregnancy, and 3 is breastfeeding. As far as relative contraindications, these include hypotension, which is low blood pressure, and any type of cardiac comorbidity. These have to be handled with care and need the approval of a cardiologist prior to taking oral minoxidil. So what happens if you stop taking oral minoxidil? The termination of treatment results in progressive hair loss. You lose what you've gained, and this occurs over the period of several months after stopping oral minoxidil. But it is okay to miss some doses here and there. I know some patients get very worried if they miss a dose or two. That is not a concern. Once again, go to feelconfident.com if you're interested in therapy for hair loss. Finasteride seems quite scary when you spend some time in online forums. But is it that bad? Is there something that doctors like me are not telling you that might change your life forever if you start finasteride? I'll share with you my clinical experience as well, having prescribed finasteride to thousands of patients. How soon after starting finasteride do side effects actually develop? They usually develop within a few weeks of starting the medication, but sometimes it can be further out. There are people who are okay for years and then start to notice that, hey, maybe I'm feeling like something is off. But typically these side effects are not subtle. When you develop one of them, you know you have it. Because some people worry that they might be on these medications and there might be some harm that's being done to their bodies, but they might not know about it, and then it might be too late to reverse those issues. But in my practice and what's reported in the literature, that's not typically the case. Usually what happens is that within the first few weeks of taking the medication, you might start to experience that, hey, something feels off. I'm having one of these side effects that we're going to be discussing. Then of course you have to report it to your prescribing physician and make sure they take you off the medication and or adjust your dose. But it has also been shown that most of the time when people develop side effects, if they continue taking the medication, those side effects tend to go away. And that's something that's interesting, and it's been reported and I've seen it in the practice. But usually my approach is to adjust the dose so that people don't have to experience those side effects. What are the most common side effects of finasteride? Well, the most common, as some of you may have heard, are sexual side effects. These include decreased libido, erectile dysfunction, and a reduction in ejaculatory volume. The incidence of these side effects is 2 to 3% on the standard dose of 1 milligram of finasteride daily, taken as a pill. Keep in mind that these side effects were found to be present in about 1% of people in the placebo group of these large clinical trials done on finasteride. So even people getting a water pill in these studies still reported some of these same sexual side effects. And there's a similar incidence of these sexual side effects of patients on finasteride in my practice. So I find that the 2 to 3% incidence holds up in my practice. And that's very different, I think, from what a lot of people believe to be the incidence out in the general public. I would say that in general, people think that the number is much higher, maybe closer to 50% or even higher. But in reality, that number is much, much lower, closer to 2 to 3%. Keep in mind that that incidence of sexual side effects will go up as you try the more potent cousin of finasteride, which is Dutasteride. And that incidence generally comes down when we go to lower doses of oral finasteride, like say 0.5 milligram every day or every other day, and especially as we go to the topical formulations of finasteride. Will these sexual side effects go away if I stop taking finasteride? Can they be permanent? Based on the literature, my surgical hair practice, and the experience of many of my colleagues, these side effects effects generally go away within weeks to months of stopping finasteride. But there are reports online and rare documented cases of post-finasteride syndrome. In other words, permanent side effects. So are doctors lying, or are patients underreporting long-term problems? Or are there other conditions related to reduced sex drive that are masquerading as the fault of finasteride? Other causes of similar sexual issues include smoking, sedentary lifestyle, poor general health, endocrine issues, cardiac problems, circulatory problems, structural issues, psychological problems, and many other potential reasons. It's often difficult even for experts to determine proper etiology, and sometimes it's easier to blame a pill than it is to dig deeper into the underlying cause. There's been no causal relationship statistically established between finasteride and post-finasteride syndrome, but one should not discount the possibility. This is an emotionally charged and controversial topic that surely needs more research. And I think that there are a few things that complicate the analysis, and that includes the limitations of self-reported data and the nocebo effect, which is where people experience symptoms because they expect to. And this issue of course highlights the importance of good communication between the provider and the patient. If someone reports a side effect symptom to me, what I often do is take them off the medication and wait for the symptoms to resolve. I then discuss with them the possibility of restarting the medication at a lower dose, one that will hopefully still be effective for helping them preserve their hair, but also one that will minimize their risk of side effects. Sometimes we bring people down to topical finasteride, and we have a video dedicated to topical finasteride. But remember that based on the concentration and the amount applied of the topical finasteride, you might be driving your DHT serum levels below what you would see with just standard dose oral finasteride. Now let's talk about some of the non-sexual side effects of finasteride. The first is breast tenderness or enlargement called gynecomastia. This is seen in about 0.4% of patients on the medication. And this percentage is actually the same as what was seen in the control groups of the studies on finasteride. Another potential side effect that you may have heard of is male breast cancer. But in 29,000 men studied on 5 milligrams of finasteride, 5 people in the finasteride group developed breast cancer, whereas 3 people developed it in the placebo group. And in another study of 17,000 dutasteride patients, 2 people developed male breast cancer in the dutasteride group compared to 1 person in the placebo group. So that incidence between the medication arm and the placebo arm is fairly comparable when you consider the size of these studies. Prostate cancer. Remember that finasteride and dutasteride reduce the volume of the prostate and have been studied extensively in very large trials. It was initially found that finasteride reduced prostate cancer risk for low and medium grade cancers, but increased the risk for high grade prostate cancer. Later, those initial observations were reanalyzed and were found to be inaccurate based on a study published in the New England Journal of Medicine. We've linked to that study in the description below, so make sure to check it out if you're interested. Early concerns regarding an association between finasteride and an increased risk of high-grade prostate cancer have not been borne out in large trials. It was actually found that finasteride was leading to earlier detection of prostate cancer, and that in turn made it look like the incidence of prostate cancer in the high-risk category was higher in the finasteride group. But keep in mind that finasteride does decrease PSA in men by about 50%. So let your urologist or primary care physician know if you're on finasteride and you're being screened for enlarged prostate or potentially even prostate cancer. Psychological issues. Depression and brain fog have been reported, though they're not common. But I think you need to be careful with finasteride if these pre-existing conditions are present. Testicular pain. A patient of mine is actually not able to tolerate finasteride because he has another condition called varicose veins, and the enlargement of the veins in the testes can give you testicular pain, and when you couple that with finasteride, which could also potentially cause testicular pain, it could be difficult to determine the primary culprit of the pain. And so this patient of mine, his urologist has instructed him to not take any type of finasteride. It's also possible to get an allergic reaction from finasteride, though again, that's very very rare. That could present with itching or hives. It can also present as facial swelling. Remember that finasteride is metabolized by the liver, so in patients who have known liver problems, it's very important to be careful with the administration of finasteride. Finasteride and dutasteride are not for pregnant women, and that's due to the risk of developmental abnormalities in a male fetus. Men are advised to stop taking finasteride for about 2 to 3 months prior to trying to conceive. Typically, this is not a long enough time period to start to experience appreciable hair loss. And men need to be particularly careful with the exposure to pregnant women of topical finasteride and cut-up tablets of finasteride. Both of those scenarios increase the risk of exposure to pregnant women. So while many people are switching over to topical finasteride, this is one of those risks that needs to be kept in mind. Patients taking finasteride should not donate blood, as this blood may potentially be given to a pregnant woman. Despite this cautionary tale, more than 90% of my patients are on finasteride and thriving, and not just for a few years, sometimes for decades. If side effects occur, we take them off the medication and then we dose adjust. And I would argue that in many cases, finasteride is more critical than a hair transplant at overall hair aesthetics. It's usually better to preserve good hair than it is to chase it later with numerous hair transplants to try to recreate what you once had. But monitoring one's health while on finasteride is very important. But do not make decisions based on fear alone. If I haven't completely scared you and you're considering trying finasteride to prevent further hair loss, you can get it cheaply and easily at feelconfident.com, or you can get it through my practice for even more personalized attention in trying to achieve your hair goals. I'm often talking about the importance of finasteride for preventing further hair loss and how that plays into hair transplant surgery in terms of being able to build on a solid foundation that the finasteride can create. But when should we consider stopping finasteride? That's an interesting question and something that we don't talk about enough. So here we are discussing when we should consider stopping finasteride. A few of these reasons might seem rather obvious to you, but I think a few of them will actually surprise you. One reason is if you're continuing to lose hair. Remember that finasteride has the ability of controlling hair loss in about 90 to 95% of men. That means that it brings hair loss to a halt in 90 to 95% of men. But if you fall into the 5 to 10% of men that don't experience a cessation of hair loss, then you might consider stopping finasteride because it's not doing enough, and potentially bumping up to the more potent version, which is dutasteride. Dutasteride, at its most common dose of 0.5 milligrams a day, is protective in about 98% of men, compared to the 90 to 95% of finasteride. But sometimes you need to increase the dose further, and I've gone as high as 2.5 milligrams per day of dutasteride to be able to control someone's hair loss. But as you make the switch from finasteride to dutasteride, and as you start to increase the dose of dutasteride, what happens is you increase your side effect potential as well. So increased efficacy also comes with increased potential of side effects. So for example, when it comes to sexual side effects, with finasteride the incidence might be 2 to 3%, but with dutasteride it climbs to as high as about 4 to 6%. So that's almost double the incidence of sexual side effects with dutasteride, and that's one reason why we don't start with dutasteride for most men when they're first experiencing hair loss. So you're essentially stopping the use of finasteride because it's not doing enough. That's surely one good reason to stop its use. Another reason to potentially stop the use of finasteride is if you're experiencing an allergic reaction. This is very different from a side effect. A severe allergic reaction might come with life-threatening consequences, and they can happen very quickly. And this is something that can be experienced with any type of medication, but it can also happen with finasteride. So we have to be aware of some of these signs and symptoms of an allergic reaction, and that includes rash, hives, difficulty breathing, facial, mouth, or throat swelling, Luckily, these are overall very rare with finasteride, but remember that people can be allergic to anything other than maybe water, so it's very important to be on the lookout for some of these signs and symptoms that can be quite troubling and that can come on very quickly, and one of these reactions might actually land you in the emergency room because of how severe it can be. So never discount the potential of one of these allergic reactions when taking any new medication. And if a reaction like this develops, then I would completely stop the use of finasteride and never take it again. And make sure to tell future doctors and clinics that this is one of your allergies so that they consistently list it on your list of allergies. Another potential reason to stop the use of finasteride is if you're experiencing one of its known side effects. That can include one of the sexual side effects that many men fear, or one of the other side effects that finasteride has been associated with. And there's a short list that we're providing here for reference. Side effects from finasteride usually present in the first few weeks from when the person starts taking the medication. The general recommendation is if you develop one of these side effects, you should stop the use of finasteride until at least that side effect clears up and you're back to normal. You would then potentially restart the use of finasteride at a lower dose. Side effects tend to be dose dependent, so as you come down on the dose of finasteride, usually you have fewer side effects. Now, this type of de-escalation of the dose of finasteride should be done under supervision by your doctor, and not just something that you're doing at home on your own without any input from a medical professional. Now, of course, some people who develop side effects from finasteride might choose to permanently stop the use of finasteride. That's understandable, but keep in mind that there is no true substitute for preventing the further loss of hair compared to the efficacy that finasteride can provide. And what I found in my practice is that when I bring people down to a topical formulation of finasteride at, say, 0.3%, it's very rare to have a side effect. Is it possible? Sure. Is it extremely unlikely? Yes, it is. And the incidence is not as well documented in the literature because it's a newer type of administration of finasteride, but in my practice, I would place it at maybe under 1%, probably closer to about 0.2 to 0.5% of people who are on 0.3% finasteride topical who might still have a side effect. So that is of course a consideration, but because the efficacy of topical finasteride is surely significantly lower than oral finasteride, we don't recommend that people start with the topical form. Another reason to potentially stop the use of finasteride is for pregnancy planning. Finasteride can affect semen in several key ways: lowering the volume, lowering the sperm count, and reducing sperm motility. Now keep in mind that there's no substantial evidence to support the claim that finasteride will permanently cause infertility. Instead, semen quantity and quality will restore back to normal in about 3 to 6 months with the stoppage of finasteride, according to several studies. So in my practice, I usually recommend that male patients stop the use of finasteride for at least 3 months before trying to conceive. Once a healthy pregnancy is confirmed, they can then resume the use of finasteride. And it takes about 6 months to start to see some of the potential continued fallout of hair if you've stopped finasteride. So usually if you've just stopped for 3 months to 6 months because you were looking to confirm a pregnancy, well, then you should be safe from a hair loss perspective. Yet another reason to potentially stop the use of finasteride is because maybe you no longer care about your hair. Because some guys tell me, look, I just want to have hair so I can find a spouse, and then I don't really care what happens with my hair. Or they say, look, I just want hair to get through my 20s, and then if I lose my hair, so be it. So if you're in that boat, if you reach a point where, you know what, it doesn't really matter if I have hair, if I don't have hair, well then you can surely stop finasteride, but be ready for continued hair loss. Remember that finasteride is a generic drug, so it shouldn't be too expensive to obtain. So if I haven't scared you yet from trying finasteride, remember that you can get finasteride shipped to your door at a very affordable price. So if you're interested in that, you can head to feelconfident.com. And if you have any finasteride related questions, make sure to leave them in the comments below. I'll try to get to as many as I possibly can. And if you have a very specific clinical scenario, it's best to reach out for a consultation.